the theme of this year's conference has been, what do we have to be optimistic about? And so I would like to start with each of you, if you could talk about your experience in the field and what you're optimistic about in the future. And I'll start to my right, which would be Alberto.
I think the future is bright because, we have learned that medicine makes a lot of progress, and usually these progress are faster than we predict. We saw an incredible improvement in the way to diagnose CJD in the last 10, maybe 20 years. And I cannot tell you what will happen in the next 10 years, but I know for sure that there will be some improvement. I think that there will be some improvement in diagnosis, and I hope there will be improvement also for treatment. That is very, very important.
Inga?
Yeah, I just can echo this. I think we made substantial progresses in last years. Also, of course, because in this rare disease, there were so many people working together, and because this is, I would say, a joint achievement of many, many groups around the world. And I'm optimistic because I see that we made this progress in diagnosis. I hope we will also make something comparable with treatment and with these new methods which are emerging with gene therapy. I think we are probably on a very good way. Of course, this is a long road, but when you think 20 years ago, nobody was even talking about treatment, and now we are talking about how to design an optimal trial. So I think we are on a good way.
And Simon?
Yeah, I would just extend those comments and share my own optimism. I think we're going to live through an era of some really exciting experimental treatments in CJD. I mean, look, how can you say a disease as awful as CJD that something's exciting? But, you know, this is what we've dedicated our career to potentially changing the outlook for a disease as awful as this. And, you know, we know exactly what the target is. We have to hit prion protein, we have to take it out, we have to stop it from joining in this pathogenic process. And you know, it does seem as though modern biotechnology is going to deliver a range of tools that are able to take out proteins. And, you know, it is going to be exciting as an academic clinician to see those enter the clinic and see whether we can really start to turn this around. I think that's going to happen, and that within the next 10 or 15 years, we are going to see a wave of treatments enter the clinic, you know, to be tested. I'm not saying I know something's going to work in that time, but there's going to be a wave of things that will be tested. Yeah, and that's cause for optimism.
Well, I have to say it's a little ironic that you all are on the same call, because I think much of my optimism stems from much of the work that the three of you have done, especially over the last 5 years, that I think has actually given rise to us being optimistic. So on behalf of the families, thank you, not just for what you presented today, but also for your work and dedication in the field in the past and being able to give us this optimism. And thank you so much for staying up so late to talk to us. Thank you very much.
Thanks to you, Brian. Thanks to you and the CJD Foundation. Yeah.
Thank you.
Thank you.